It's really a pleasure for me to be here in this meeting because I've heard very nice words from the last year participants, and I know very well the lecturers that came here last year, Professor Elisabetta Cotti and Dr. Anthony Schianotis, and they spent very nice words for this meeting, for the people that organized it, for the attendees. So it was really a pleasure when Chris called me and asked me to participate to this second edition, and I was very happy to come here in Poland, also because it is the first time for me in Poland. I have traveled all around the world, but the first time in Poland, so it's really a pleasure to be in this important event. I think it is a very important step of the treatment that can be improved and can help us to improve our clinical outcomes and clinical results. We know obviously that we need to remove bacteria from microorganisms from root canals, and we can do combining a mechanical preparation with a chemical irrigation, chemical actions of our irrigants. That is a very, very important step in our treatments. More and more it is becoming more and more important, even because our mechanical preparation phase is during very less because of the efficiency of the instrument. So we must increase our chemical irrigation and the activation of our irrigants to improve disinfection and removal of contents from the root canals. We have to join our weapons. We must use our weapons and join the weapons to obtain the maximum results. So we have to use the correct liquids, the correct chemicals for the different phases, for the different actions that they aim to have. We must use as much devices as possible, combining them as they can be used for different purposes to enhance the quality of disinfection. Obviously, we have to dedicate our passion to this phase and to all our profession, because it's in our mind, in our passion, that we can arrive to a good result. Dedicating time to our procedures, do not hurry, and dedicate our passion and our time to our patients. We know obviously that the main cause of endodontic problems are the microorganisms and the bacteria present inside the root canals. So what is our fight is to remove as much as possible the contents, microbial contents of the root canal system. We know that it's impossible to sterilize 100% of the root canal system, but our aim is to reduce as much as possible the microorganisms content inside the root canal space. So the main problem is the removal of the microorganisms. So the main fail is if we do not dedicate so much time, so much efforts to remove the contents, microbial and biological contents of the root canal system. Then with our liquids, we must keep attention because they can cause also some iatrogenic damages. For example, some liquids are toxic. We must keep a lot of attention to avoid extrusion of the liquids in the periapical tissues because they can create damages in these tissues.